Blossom. I'm Rachel and I'm the Clinical Director of the team. We're a small independent occupational therapy and speech and language therapy company, and we primarily support children between 2 and 18 years of age. So we specialise particularly in supporting children with neurodiversity or that have experienced any early trauma and attachment difficulties. So our team is based here in a clinic in Stanyun Village, Northamptonshire, but we are also able to support children and families within the community. So this means that we can visit schools, we can go to the child's own home or nursery or wherever it is that is deemed most suitable to support that child. So within our team, we have a mix of occupational therapists who are all specialists in paediatrics, and we also have a couple of speech and language therapists, so we're able to provide some joint working together as well as individual support. The sort of children that may benefit from accessing our services are those that may have a diagnosis or may not, but they may be struggling to engage in everyday life. So this might be something within the school environment. They might be struggling to engage and be involved in group activities with other children. They may be struggling with things such as handwriting or motor skills, being able to dress themselves, or being able to take part in PE and sports and games, things like that. Or they may be really emotional, so maybe they're struggling with their regulation. You might see difficulties after school, and maybe school aren't observing the same presentation within your child. That's quite typical, but they're the sorts of children that we may be able to support within our team as occupational therapists. Within our speech and language therapy offer, we can support children that are struggling particularly with speech sounds. They may have social emotional difficulties, so could be quite anxious around social communication. We're also able to support those that have situational mutism, where they're not able to speak with certain people or in certain environments and situations. And our other speech and language therapists can support those children that are pre-verbal. So those that may need other methods of being able to communicate, and they may be starting to develop some of their words. As well as this, we're able to support those that may have some difficulties with feeding and drinking skills. So we are able to look at that with a holistic approach, so looking at the sensory element of that, but also with the speech and language therapist understanding the process of eating and what might be some of the triggers or the difficulties within that situation. Within the team, we can provide specialist assessments. We can look at providing specialist therapy for individual children as well, and we're also able to provide training and coaching packages as well, where actually that's deemed to be more helpful. We offer a range of different training, so these are ready-made talks that are available, and you can see some of these on our website. Or additionally, we're able to make bespoke training around the needs of what it is that you require. So if you're able to think of a specific area of need within your school or within your workplace, you can let us know that, and then we will provide a talk that's suitable for what it is that you're needing. So we are able to accept referrals without a diagnosis. Children do not require a diagnosis to access our services. We base our support around the child's presentation, so it's very personal and child-centred, but we are able to support children, families, and also the school or the professionals that are also working around that child. As part of our offer, we also have some school commissions. So this usually is accessed by schools purchasing a bulk of hours, and then they can be used however is deemed to be most helpful for your school. So some schools are aware of what it is that they require in terms of the additional support, but other schools would like to access the service but are a little bit unsure about how best to use those hours. So we're able to get to know the school and make recommendations on that. Within our team, we're trying to provide really specialist and child-centred approaches to all of the work that we're offering. So we're very, very passionate. We're a small team and we're really passionate about trying to provide the very best that we can so that children are able to engage in everyday life situations, whatever that might be that's a barrier for them. So there are times when we're able to work with other outside professionals. We provide multidisciplinary assessments and support with other professionals such as psychologist teams where we are able to access independent support from them. And we're very keen on trying to meet the gaps of where children most need the help and they're not able to access that. So if you've got any questions, anything you want to know about our offer, please do get in touch. If you're not sure whether this is the right service for your child or a child that you're supporting, please get in touch and ask us, and we'll do our best to try and guide you or signpost you to other services if actually we're not the most appropriate setting.
We look forward to meeting you.